Hello, welcome back to my YouTube channel. I'm Lucy, Her Country Living. Now I'm going to put out a little warning because this is a difficult video for a lot of people. It's taken me over a year to film and come to terms with. So if you are experiencing or have experienced birth trauma, this might not be the right video for you to watch at the moment. But if you are looking for some solitude or, you know, feeling that you're not alone and want to know a little bit more about my birth trauma and what happened to me, then please continue to watch. I've also put a link at the bottom of this video on some help pages if you are feeling not great and are struggling at the moment. I had my daughter. I was pregnant in 2001 through to 2002, and I had Tabitha, my perfect, amazing, lovely daughter, in August, just after my birthday. Up until that point we'd had like a couple of things here and there. One of them was we had quite a high chance of her having Down syndrome. It was 1 in 15, and that's an optional test that you can do in hospital, and that I found quite difficult because the only options at that time that were given to me were abortion. That was the only option that was really given to me, and anyone that we told, which was not very many people, only very like close family members, their reaction was some of them were very supportive and very kind and caring and understanding, and some of them basically just said, well, you're going to have to get an abortion. And that was one of the most difficult parts of my pregnancy and dealing with that. I had chosen before getting the results back not to get an abortion, and I would have 100% kept the baby regardless of the outcome of Down syndrome. I've done a lot of research. I'm now friends on Instagram with a really lovely mum whose daughter's got Down syndrome, and I just think there's not enough education around that, and the fact that you can still have an abortion up to I think it's 37 weeks, which is absolutely insane in my opinion for things like Down syndrome, cleft palate and other things. Just, I don't even know where to begin with that, and I think it's personally awful, as you can have very, you know, fulfilling lives with Down syndrome. I'm not even going to get started on cleft palate because it wasn't something that impacted me, but the fact that that's even an option is just outrageous. But there we are, that was the first thing. So yes, that came back and that was all okay after we had to wait over a week, and I found that really difficult, not knowing anything about it, not knowing what would happen, and not really having much of a support around me. It was also quite difficult for my husband, understandably. So anyway, that aside, pregnancy was not too difficult, and we were told that my birth would be, or Tabitha's birth would be normal, there wouldn't be any problems, which was very far from the reality. And whilst I think it's difficult sometimes to predict those sorts of things, you can predict if someone's going to or be vulnerable to things like trauma. Now, growing up, you know, in my life I had things happening to me that were not great and did cause quite a lot of trauma, from being attacked to having abusive relationships in the past. Yeah, lots of different sort of things like that, and it's not easy to talk about, and I haven't actually been able to talk about a lot of those traumas and difficulties since I had a therapist, until I had a therapist, which was earlier this year, which I'm being open and honest about. And I don't think there's any stigma around that, and if there is, there shouldn't be. It's a way of healing your mind, and trauma is a real thing. And it's a real thing that unfortunately more and more mothers are going through at the moment as well. And I just think there should be much more help and support for women that go through these sorts of things. So I would say my trauma started as I was being induced and going into labour, as it were. I was put into labour. Tabitha wasn't ready to come out. She was 42 weeks and she just wasn't ready. It got to a point where I was in so much pain. My heart rate was fluctuating, Tabitha's heart rate was fluctuating, and I don't really even remember the ins and outs of it, but I got whisked down to the doctor-led unit in the hospital after I'd been up in the induction suite before you go down to the midwifery delivery suite. and I never even saw it there, and I just went straight down to the doctor-led unit. Wasn't really sure what was going on. It was difficult, traumatic, and lots of things were happening. We were also left on our own for quite a lot of time whilst I was in severe pain, and my husband was looking for people to try and help, and was actually told off a number of times for being out of the room and not just waiting. And it's not like we were waiting for 10-15 minutes, it could have been like, you know, 2-3 hours sometimes. So anyway, when we got down there, things started to just go from bad to worse, and I had an epidural. The pain was honestly that bad. Things were just not working properly as they should. So I had the epidural after I had specifically told my husband I wasn't going to have one. I did, and the epidural failed. It'd been put in my back incorrectly, and the machine kept beeping and telling me, like, you know, it's not working. I kept pressing the button, nothing was working. We'd been down there for hours and hours and hours. We kept calling someone to come and help because of the pain I was in. No one came. When I had my waters popped prior to that, the water came out really like dark, and the midwife was like, oh yeah, that's normal, but that's actually not, and it is a sign of infection in the mother or the baby. And it did turn out that both my daughter and I had quite serious infections, and that meant that we had to stay in hospital for a bit longer after the birth. Excuse me. And Tabitha ended up being on antibiotics, which, great, I'm really glad that we've got them, but I still to this day don't know what the infection was, why she was on them, X, Y and Z. Anyway, I'm digressing. After we then saw the new anaesthetist that came in and put the proper epidural in, I got whisked into the emergency room because I needed an emergency cesarean, which I had to agree to, which I think is insane. I think you should be asked to agree to that prior to giving birth. I think it should be something that you agree to, that if you need one you should, you know, be asked prior, because in that situation I'm in horrific pain. I am on all sorts of different drugs which are making my mind go doolally to help with the pain, and I haven't slept for God knows how long, and I'm an emotional wreck because I've been told that I need an emergency C-section, my baby might die. So I had to agree to that, which was insane, but obviously you would agree to it. It would have just been nice to have known a bit more about it prior to going into that situation, but I didn't. And anyway, it got whisked away. My husband really needed the loo, and they wouldn't let him use the loo that was just down the hallway for patients as we were going in for the emergency C-section. He had 5 minutes, I think, that he could have done that, and someone had a go at him and was like, no, you can't use that, that's only for patients, you need to go and use the loo that's like all the way, God knows, you know how big hospitals are, all the way down in the middle of nowhere. And that would have meant that he would have missed the birth, not been allowed in the room, you know, had he come back in time, and he wouldn't have been there if I died or my daughter had died. You know, if anything had happened, he would not have been there. So he just had to wait, and yeah, that could have caused another set of problems, you know. So anyway, that happened, and then yeah, she was born. We went up to the delivery suite, and I wasn't like feeling connected, and it was just, things were difficult, and I was just like, oh my god, oh my gosh. And then a midwife came in, or a nurse, and was like, oh, your baby's saturation levels are really low, we need to take her now. And I was like, what is going on? And this woman just took her, but without any explanation, just took her. I couldn't walk, so I just had a cesarean, and my husband John had to go with her. His phone had died, and because obviously he's not been focusing on that, and so he left his phone on charge without even thinking, just went. And I'm then sat in this room surrounded by all these other mothers who are like very happy and with their husbands and their children, their new babies, alone on my own without my husband or daughter, who, as far as I'm concerned, could have died, not knowing what's been going on. And I was left there for, would have been about an hour and a half, and a lady came back and was like, oh, your husband wants his phone. And I was like, where's my daughter? Like, what's going on? Can you give me some sort of information? Nothing. Anyway, I gave her his phone without even really thinking, and then I got a message off him just to say, from memory, I think it was like, you know, she's under observation, she's been put into an incubator, and we're just waiting to find out what's wrong, basically. Another hour lapsed and I go down there in a wheelchair, and I just broke down. I just couldn't cope seeing, you know, this little baby that I've made, that I've loved for the last 9 months, in an incubator fighting for her life. It was just horrific, and no one telling me what was going on, and I was just in absolute tears and an absolute wreck. My stomach's like, all the muscles are broken, my stomach's been cut open, it's all flabby and uncomfortable. All I'm wearing is this nightgown, and that was it. And I'm surrounded by all these people, and there's other parents in there having the same sorts of problems, and the midwives are just like, you know, they clearly see this every day, and they're just like so unempathetic and had no feeling or sensitivity to how I was or what was going on, and it just was really triggering, and it made me feel like I couldn't feel like that in that situation. Anyway, we then had to stay in hospital for a couple of days. It was the hottest day of the year those days. There's no aircon because babies can't have aircon because they can't regulate their temperature. It just got too much for me, and luckily my husband got me moved. This really nice midwife called Chloe got us moved to our own room, me and Tabitha, and that helps a lot, and it just sort of settles you down. And yeah, it was just, I suppose, quite difficult to go through those sorts of things. And anyway, we managed to get to a point where we could take Tabitha home, and would then have to take her back into the hospital every day for, I think it was 5 days, for antibiotics. And I've got photos of her just lying on this bed, like with all these wires attached to her, and having all this stuff put in her, and I don't even know why or what's going on. And yeah, it was very stressful and very difficult. We were also in the process of moving, so there was boxes all over our house, everything was packed away, I was having to still pack, and having to recover from pretty horrific surgery. And we were also not far off of our wedding, which we'd planned, and we couldn't back out of, and we'd have lost a lot of money if we had. Obviously we're really glad we went through with it, and it was a wonderful day, but you know, at that time it was just a lot to take on. And yeah, I suppose after that I just continued to have, I suppose, night terrors and be quite scared and find things generally quite difficult and not really be in my right state of mind. I was then diagnosed with severe post-traumatic stress disorder, and that answered a lot of questions for me as to why I was feeling like I was. Your brain basically just goes into like a shutdown, and you have sort of two options. It's really interesting if you look into the medical side of it. So your brain will just go back to kind of like the basics of, I'm going to fight or I'm going to flight, so you get really protective. So Tabitha was crying and I was holding her, nobody could take her off of me. I was so protective of her because I was just so scared of like losing her or something happening to her. So there was that, and then there's also the flight, and sometimes I just said to John, I just need to leave, I just can't be here right now. And I just didn't believe my child was alive. I didn't believe that I had that child, and it was really scary, and not a lot of people really understood it or were very supportive of it if I explained it to them, especially people that hadn't been through childbirth or had had a very easy childbirth, or people saying things to me like, oh, I don't know what you're complaining about, having a baby is as easy as having a dog, or comments just, you know, not being very supportive. And quite honestly, when you're in that situation as a mum, and someone going through all of that, you need all the support you can get, and you just don't have the brain space or the brain capacity to deal with anything else. So when things come at you, it's very, very challenging. So whilst all that was going on, I was still working on Her Country Living, and I was still doing the odd job here and there to try and just, you know, make ends meet and try and help support our house move and this new baby that I had. And to the outside world I looked probably totally fine and normal, and people probably have no idea that any of this went on, but it got to a point where I really considered suicide, and I honest to God considered not being here anymore, and occasionally still do sort of feel that. And whilst I'm a lot better, you know, I've been on intensive treatments with a therapist, and have also been on some medication. I would say it's not fully recovered and not fully gone away, and I would honestly blame a lot of what happened at the hospital for this, and the negligence as well. It's also worth mentioning I had no support network when it came to oh gosh, what are they called? Health visitors, that's what they're called. We had one come and visit us when we live in Oxfordshire, and I asked her like lots of different questions. I was scared about an infection that was going on in my C-section, so I asked her about that. I just got no support and no help. She was like, well, I don't know, I can't help you with that. No help with feeding with my daughter, and I really struggled with that because I struggled to think it was my child, so I had just no support. And then when we moved here, we had a health visitor visit us once, and I texted them a couple of times and I had no response. I tried to phone them as well, no response. And I've dealt with a lot of this myself. My husband's been extremely supportive. I've got an amazing husband, and yeah, he does a lot of support for me and Tabby, and he's just a great dad and does an awful lot. And I just also just want to mention that I'm noticing increasingly women moaning about their husbands doing not enough for their children, and saying things like, you know, oh, he's never changed a nappy, and he just thinks it's difficult to look after her for like 40 minutes, or him for 40 minutes, their child. And I'm just like, why did you have a child with this person if they are that incompetent and useless? I just don't understand. It's 50-50, and I know, you know, there's people going to be watching this thinking, why are you saying that? You're a woman, you should be looking after the child. And I do. I also do a lot of the housework. I also look after our cats. I also do cooking. I also, you know, garden. I also sort out DIY stuff that needs doing. And I look after my daughter. And I run my own company. And I was also working for a huge company as well at the time. And my husband, he works as well, but he also does help me with those things. Do you see, this is society making me think that he's helping. He also does those things in our house because it's his house and we have a joint partnership here. It's not, you know, it's not like I don't, you know, do anything other than, you know, housework or whatever. I have a lot going on as well. So yeah, I provide an income, and so does my husband. So yes, my daughter's over 1 now. I've got over a lot of those difficulties, but things are not still always brilliant, and things can still be quite difficult. And I guess another difficult part of this and talking about this is, you know, I'm quite privileged. We've got a beautiful cottage that we own. We have got, I would say, an okay income. Others would say a very healthy income, but I suppose it's all relative, isn't it? You know, I earn a good salary, my husband earns a really good salary, and you know, we're quite well supported by family, you know, with childcare and stuff, so I've not had to fork out any money for childcare. And yet, you know, I still feel these things and go through all of these difficult things and experiences that people just don't know about because they've just seen the exterior and they've never seen or really know about what has gone on or happened in life. I honestly was at a point where I was crying in a bath in a beautiful hotel that I was working at, and I was just like, why am I crying? Look how privileged you are, look what your job is. And I was there just like, I don't want to be here anymore. And yeah, I didn't think I was ever going to get out of that space, and no, I have, and here I am today. And yes, there's things I'd like still to get better and change. My sleep's not good still, I can't sleep properly, but we're on the road to recovery and things are looking really, really good. Life's good, the cottage is coming along and it's stunning. My daughter was walking quite early, which I loved. She started babbling away and talking a little bit. She talks a lot, but baby talk, but she's talking a little bit of like English. And we're looking at getting a puppy, and I'm 100% put off of having any more children as a result of this traumatic birth and what happened to me, which I'm still going through, and will at some point need corrective surgery because this was not stitched up properly, which was part of what I had to sign to say you may be incontinent, you may never be able to know when you need to do a number 2, and you know, your stomach might be completely messed up, which it is. And as a result, I've struggled with exercise, so I've put weight on. Anyway, that's, yeah, all of it. And it's going to be difficult putting this out on the internet for millions of people to watch, and friends and family to watch, but I think it's important to, because I'm much stronger now, very comfortable with who I am, have an amazing career in life, and things are definitely on the up. So yeah, I was making it for all of those women who are out there and who are feeling kind of how I was, because it would have been nice to have known and had someone talk to me about this at that stage. So I hope this helps you, and I've put at the bottom places that you can go and get help, which I've since found out about. I hope you found this video informative. Please do subscribe, and I will see you on our next video, which will be a lot more in line with what I usually do. So bye!